we have some early birds in the call. Maybe let me just turn on my video so you can also see me. My name is Cecilia Rodriguez, and I'm a GIZ staff and part of the SuSanA Secretariat team in the headquarters based in Ashbourne. I'll be moderating the session today, which, as you can see, is the session from Working Group 7, updates on washing schools, as part of the official program of the 30th SuSanA Meeting. We have two special guests today. One of them is Bella Monse, my colleague from the sector program, who also works for the regional program on Fit for School, and also part of the global WinS network. WinS means washing schools, wash means water, sanitation, and hygiene. So just that we are on the same line. And she leads the working group on program guidance. Our very special guest today is Christie Chatterley, and she is a member of the JMP team. JMP stands for Joint Monitoring Program, combined from WHO and UNICEF, and she has been deeply involved in developing the GMOP indicators for washing schools, and she's an active member of the WinS Global Network and leads the working group on monitoring and evaluation in washing schools. So that's the program that we have for today. Christie will be presenting on the JMP report on the global status of washing schools. We'll have some time for discussions where you can pose your questions either in the chat or lifting your hand in the functions in your browser in Microsoft Teams. Then afterwards, I will invite Bella Monse to introduce to us the WinS Global Network, also followed by some discussions. And of course, afterwards, we'll be happy to have your inputs as working group members. I would like to ask you all to mute your microphones during the call. And also would like to alert you that this call is being recorded. So without further ado, I would like to invite Christie to start the program. Start her presentation. Christie, you can try to share your slides, otherwise I will try it from here.
Okay.
Can you see that?
Yes.
Is it
Yes.
in full screen mode?
Yeah.
Perfect.
Fantastic.
Thank
All
you.
Good morning, good afternoon. Thank you so much for the opportunity to share our new report. This is also available on the JMP website, washdata.org, and that website will be on the last slide as well. So I'll go through quite quickly some of the highlights. We have a special focus on COVID-19 for the whole report, which WASH is a huge
Christie,
yeah?
Let me just interrupt you for a tiny bit. Probably you have this screen where you have your mouse on. It's in the middle of your presentation, so we can see it. I don't know if you can drag either to the bottom left or to the bottom right.
Is that better?
Yes, perfect. Thank you very much.
Oh, no, thank you. It's hard to see charts if there's a big square in the way. Wonderful. So we know children need to be in school, both for learning outcomes and for school-based services that children depend on for nutrition and other things, particularly the vulnerable population. But they really need to do that safely, especially in this pandemic. So there's guidance that has come out for safe reopening and operation of schools. And within these, we see a common theme of the importance of hand washing facilities with water and soap, daily disinfection and cleaning of surfaces, as well as basic water, sanitation, and waste management facilities. And these are things we've always needed. So hopefully COVID-19 is just this extra pressure to push us to really providing these critical services sooner rather than later and meeting the SDGs, hopefully well before. So just a quick reminder, or for those that don't know where Wash in Schools falls in the SDGs, it's under Goal 6 for water and sanitation. The wording in the SDGs talks about services for all and universal services, which means that everyone needs water and sanitation, not just at home, but when they're away from home, school, healthcare facilities, workplaces, etc. And then Wash in Schools is explicitly under target 4A, where the indicator is the proportion of schools with computers, internet, electricity, adapted infrastructure for students with disabilities. And then the last three are basic drinking water, single-sex basic sanitation, and basic hand washing, or altogether that would be basic wash. And there's a note in the SDG language that says, as per WASH indicator definitions. And that's referring to these definitions here. So in that second row down, we have the definitions of basic service. So for drinking water, that means that schools have water from an improved source, and water is actually available at the school at the time of the survey. For sanitation, they're improved facilities, so a pit latrine with a slab, flush toilet, and the toilets are single sex, and they're usable. They're available, functional, and private. And then for hygiene, there are hand washing facilities with both water and soap available. And the JMP uses what we call service ladders to try and encourage progressive realization of that basic service level. So in the middle there in yellow, we have a limited service, which means infrastructure is there, but a service is not being provided. So a drinking water facility or a toilet has been built, but either water's not available, or the toilets aren't single sex, they're not usable, or there's water in a hand washing facility but no soap. And then that very bottom rung is a lack of infrastructure or unimproved facilities. So you'll see these kind of three colors in the charts as we go. This upcoming report used 814 national data sources. We don't collect data ourselves. We send out a request for data to countries, and then we get information back. We scour the internet. We compile everything together, and then we send it back to countries for validation through a country consultation process. So we had a lot more data to work with this time around. In the baseline report in 2018, we had just under 500 sources, and we now have estimates for 173 countries, which is pretty exciting. Most of these data are from EMIS and Census and UNESCO Institute of Statistics data, but we do have some nationally representative surveys in the data set as well. So let's look at the results. We have basic drinking water estimates for 120 countries and 6 out of 8 SDG regions. And you can start to see trends in the chart from 2015 to 2019. So it's a pretty short time frame and based on the information that's available. So hopefully we'll see these trends build over time. Based on the 2019 data, globally, we estimate that just under 70% of schools had a basic drinking water service before the COVID-19 pandemic. Hopefully we'll see that go up. And that means that 584 million children lacked a basic service at their school. And if we look at the trend, it's quite shallow. It's not going up very fast. And so if we project that out to 2030, we find that we need to increase the rate of progress by 7-fold just to meet the SDGs by 2030. Again, hopefully this will be much faster for meeting the needs of COVID. For sanitation, we have estimates for 117 countries and 7 out of 8 regions. And globally, we estimate that 63% of schools had a basic service before COVID-19. So just under 700 million children did not have a basic service. And then looking out towards 2030, we need to amp things up by 5 times to meet the SDGs. And then for hygiene, we have estimates for 110 countries and again, 7 out of 8 regions. For 2019 globally, we estimate that 57% of schools had a basic hygiene service and 818 million children did not have a basic service at their school. And again, projecting out to 2030, we're increasing at a faster rate for hygiene, but we still need to increase fourfold to meet the SDGs by 2030. And we can do this for water and sanitation, but just as an example, we're looking at hygiene. If we break down those regional and global averages to looking at the individual countries, we see that there's a very wide range of coverage, with some countries having very, very few schools that have the basic service level. And then if we dig down even deeper, we see a lot of disparities within countries as well. So this is an example looking at Syrian Arab Republic, where it's one of the lowest coverage countries in the region. But then if we go within that country, we don't have urban and rural data, but we do have data for different governorates. And we see that there are big variations between them, with 3 governorates in the Syrian Arab Republic without any schools that have basic hygiene service. And similarly, we see a disparity or an inequality between school levels, where pre-primary has a lower service than secondary and primary. And this is a trend we see throughout the SDG regions and throughout the different elements of WASH. Secondary schools tend to have higher coverage than primary schools, and pre-primary schools tend to have even lower coverage when we have those data. But it's pretty rare that we have pre-primary school data. For urban and rural, we had 2 SDG regions that had enough data that we could look at this at a regional level. And we see that urban areas tend to have much higher coverage than rural. Sometimes this is quite a large gap, such as in sub-Saharan Africa. We see that almost half of urban schools have basic hygiene, but around 1 in 10 rural schools have basic hygiene. It's quite a big difference. And that's common at the national level. Some countries have a really large gap between urban and rural. And then there's a few countries where the opposite trend is actually true. So we've been focusing on basic service, and just as the name suggests, it's a very basic service. This is something that every school should be able to hit by 2030. But it doesn't mean that all of the human rights criteria are being met. So the JMP encourages an advanced service level to be developed and defined at the national level, depending on local context and resources. And this could include things like water quality testing, water continuity, student per toilet ratios, menstrual hygiene facilities, toilet cleanliness, group hand washing, and the accessibility of all these services to students with limited mobility. So we looked at some examples of countries that are monitoring these higher levels of service, and these are throughout the document, but I just pulled out a few examples here. And so Mali collected data on the accessibility of WASH services to students with disabilities, and we found that when you look at all 3 WASH services, only a quarter of schools had all 3 basic services. And then when we look at the accessibility of those services, about 1 in 10 schools had basic and accessible WASH services for students. In Nigeria, they're collecting some interesting data on menstrual hygiene. One of their examples was looking at water and soap availability in the girls' toilets, and you see quite a large gap between urban and rural schools there. And in Bhutan, they asked adolescent schoolgirls why they miss school during their periods, and these lower 2 rungs are infrastructure-based. So around a quarter of adolescent girls agreed or strongly agreed that they miss school because they don't have anywhere to wash and change at school. They don't have anywhere to dispose of sanitary pads. So these are necessary services, but they're not sufficient. So these top 3 rungs or bars that we're looking at are things like, I miss school because I have pain during my period. I miss school because I feel uncomfortable, or I'm afraid people will make fun of me. So we need these infrastructure and services, but it's not sufficient. We need to make sure these other elements of menstrual health and hygiene are being looked at. That was an interesting example. And then specific to COVID, in Tunisia, they found that 1 in 5 primary schools did not have sufficient equipment, products, or staff for regular cleaning and disinfection. And similar to that Mali example, we see that trend in a lot of countries where there might be, for example, in Nicaragua, over half the schools have a basic drinking water service. But when we look at the proportion of schools that have all three, water, sanitation, and hygiene, we find that just 1 in 100 have basic wash services. And that's similar for the countries where we had microdata to be able to do that analysis. And these 3 elements of WASH are 3 of 7 in Target 4A, which UNESCO Institute of Statistics is the custodian agency for. And these spider maps just show some examples of how coverage varies across those 7 elements. So you'll see in some countries like Myanmar, WASH is higher than the other elements. In others, like West Bank and Gaza Strip, hygiene is low, and infrastructure for students with disabilities are kind of the constraining factors, and it really varies country to country. So if you want more detailed data, I know I ran through that quite fast. You can go to washdata.org, click on data, and then schools. And from here, you can create your own chart. You can look at different indicators. And then if you hit this download data button, you can get the country file that has all the data sources and assumptions that were used so that you know what went into these estimates for a particular country. So moving forward, I think we need to continue harmonizing definitions and addressing those data gaps. It's kind of shocking that 2 SDG regions do not have basic drinking water estimates at this point. So really trying to make sure that we cover those gaps. And then we need to progressively improve into that advanced region, looking at things like menstrual health and hygiene. And to support this, there's a core questions and indicators document on our website that was developed by a number of experts in the field to try and get some agreement and harmonization.
There we go.
And that is all I have. If you have questions, but I'll pass this back over. Let's see. Great.
Thank you very much, Christie. Hi, Right Harvey. I just want to let you know that your camera is on, so you are in the screen. So just be aware of that. So for the ones who had just joined, we have about 54 people at this conversation now. Thank you very much, Christie, for the presentation. I would like to open up the floor for a couple of questions. You can either type in the chat or raise your hand just by clicking on the button, and then we can call you. We do have a comment from Matthias Haladin. Christie, he says that you mentioned a document with guidelines on how to prepare schools for COVID reopening. I assume that's also the document available on the SuSanA library. If it's another one, then we are happy to share the link as well. We can post in the chat, Louisa, if you could assist me, just sharing the information so Matthias can also have a look. The recordings of these presentations will be available on the SuSanA YouTube channel, as well as all the presentations related to the 30th SuSanA meeting will be also available as part of our knowledge management activities in the coming weeks. Any questions to Christie?
Yeah, I have not a question. I would just encourage Christie perhaps briefly to share a little bit how this entire data gathering over the last years has really put more efforts within governments to look at WASH in schools, to encourage activity in WASH in schools. Perhaps you can speak a little bit about that. Specifically now seeing that you have nearly the double amount of countries submitting data is a big sign that this is getting on higher attendance more attendance. So perhaps you elaborate a moment on that, because I think that could be pretty important.
Yeah, sure, happy to. Thanks, Bella. I mean, countries signed on to the SDGs, and so I think this is beyond WASH, that countries are jumping into what's in the SDGs and monitoring them. And then for WASH specifically, we've seen a huge amount of uptake of the core questions on WASH in schools, trying to harmonize for the things that make sense across countries, which is usually that basic service level. And this has included countries updating their EMIS, their Education Management Information System, which is an annual census that goes out to all schools. And so we've seen more and more countries adding the core questions into that document. And you can do that. You can monitor all the elements of basic WASH for the SDGs with only 5 to 6 questions. So it's not a lot to add. And so a lot of countries have done that and then added advanced questions as well, such as menstrual health. So the EMIS we've seen being utilized for this monitoring, and then some countries are doing more real-time feedback systems using things such as the 3-star approach, which they've also aligned with the SDG definitions and the core questions, letting schools know where they fall on these SDG requirements. Does that answer your question, Bella?
Yeah, I think that's exactly what I think. We should also remind the audience it's so important that all of us support ministries of education to integrate the key questions or the core questions for the JMP into the EMIS, so that it will be, it's so important also to keep the wording, as Christie says, so that it's really comparable at the end, what you are the data you are gathering, so that it can be compared between countries. That is very important. Yes. Yeah, perhaps we can also hear from others. There are more questions. I will not ask more than. Perhaps we go to other questions. Thanks, Christie. Yeah, very important.
Thank you, Bella. I have, there are a couple of questions in the forum, but Tapandas has also lifted his hand, apologies by the wrong pronoun, in case it was.
Yeah. Can you hear me?
Yes, perfectly. Thank
you. Is there any provision for including the health center data? Because in the context of COVID, the provisions in health centers is very important. Under JMP, you are having in schools and community everywhere, but health center data, is there any provision to include that? Because that is very important in the context of COVID.
Yes, and actually, we have just updated those figures as well. So if you go to washdata.org and click on data and then choose healthcare facilities, there are new 2019 estimates for healthcare facilities, which, as you say, is extremely important, especially during COVID. So washdata.org, data, and then healthcare facilities.
Thank you very much. Thank you.
Yeah.
Thank you,
I think
Christie.
also important to close your mic again. Right? Can you just close your mic again, because you're, because we can hear everything. Okay.
Thank you, Bella, for this hint. And we also had a kind request from Barry Jackson to write Harvey if you could please stop your video. Up to you. That's a suggestion and recommendation from the chat. Then I have here a question from Vishwanath, which is also related to the previous question from Bella Monse, which is how dynamic is the data gathering? Is it a continuous monitoring exercise, or is it a 1-year period? How are slippages accounted for? And perhaps if I can say, thank you, Ride, for stop sharing your video. Perhaps Ibrahim, if you would like to take up also this kind of request, that would be much appreciated. Christie, the floor is yours.
Yeah, it's a great question. So it really depends on national monitoring efforts. So most countries have the annual EMIS, and we rely on UNICEF and WHO country offices and national offices of statistics to send us data on a regular basis. We also look for it online. More and more countries are sharing data online. And so when we're able to find it ourselves, we'll download it. But that frequency is really up to countries. So they'll determine how frequently and how to share it. And we just try and get a hold of the data. And then on our end, we do updates every 2 years. So we'll try and get as much data as we can over that 2-year period. We'll compile it all, and then we'll share it back with the country for consultation.
Thank you, Christie. Then we can go to the question from Vicky Ferrer. And a question related to definitions. Should certain definitions be changed? How will change, how it would affect the monitoring of data related to achieving SDG targets?
It's a great question. Yeah, and early on through all this process, there's a bunch of people sitting around a table, including national representatives, UNESCO Institute of Statistics, WaterAid, UNICEF, trying to come up with definitions that would be, one, they would make sense in all contexts, and two, they would, survive and still be relevant until 2030. And so we've really tried to keep things very simple for that reason. So the basic service definitions, I think those will stay the same, and I think they will remain relevant. But there's a reason why we left that advanced level up to the national government, because that is going to change over time. I think you're completely right. Things are going to shift, and we're seeing the importance of menstrual health and hygiene. It's always been important, but it's starting to make it into the spotlight. So we want to allow flexibility for that. And part of the SDGs is really encouraging countries to come up with their own challenging goals. And so having that sort of flexible advanced level allows countries to not only define that now, but to change it over time if they want to. So I think you're completely right, Vicki. But at the basic level, we're trying to keep them the same. It's pretty basic. Water's available. It's from an improved source. Hopefully that will last.
All right. Thank you, Christie. I suggest we leave it up like this. We have answered all the questions chat in the forum, and we can get back to if any other questions after Bella's presentation and for a joint discussion. Thank you very much for being here, for presenting this great work on monitoring washing schools. And I just would like to make one announcement, that is, if you have your camera on, you'll be displayed on the screen. So just make sure that's a voluntary decision to have your images on the screen, and be also aware that this meeting is being recorded. So with that, I would like to invite Bella Monse to start to introduce us the WinS, the Wash in Schools Network. And I hope you can all see the presentation.
Thanks. I think it's still
not going.
All slides. No, you have all slides on one, so you need the presentation mode. That you have only one slide. Yeah, thank you. Perhaps yeah, that's the one. Exactly.
Yes.
Yes, I think there are still some questions related to the JMP report. I think, Christie, you might get a few more questions later on. I can see that in the chat box, and I think it would be great if you would be still around, because yeah, I think we cannot see it at the moment. Cecilia, I can only see, at least what I see, I can only see all the slides, and we need the full screen mode. I don't know how others see it. I cannot see at the moment.
Yeah, I'm asking myself as well how Christie did it, because she did it really well. Let me try it once again. Let me just do something different. Maybe it works now.
No.
Yo. So apologies for that, everyone. I'm still struggling a bit with the slides. Now?
Yes, thank you.
Perfect.
Yeah, thank you. Yeah, I would just briefly introduce the global WinS network. And I think a lot of questions I could see in the chat, which also refer to a lot of questions related to WASH in schools, will be also important for, or are already since years important for, the network. Next slide, please. Yeah. In this slide, you can also see this is a network. It's a broad network. It's an informal network. And you can see there is GIZ, they Save the Children, UNICEF, and WaterAid as strong partners, and those in the core group, and those...
We cannot see the slide.
Cecilia, you do the next slide, please. Click the next slide. Yeah, okay, yes, thank you. So you can see that this is a network. It's an informal network of different organizations, and the network has just worked a lot on knowledge products during the Corona crisis. I think you missed one slide, the previous one, to introduce what's the network doing. I think there's one more slide in between. Can you check that again, one back, Cecilia? It's not the intro. Yeah.
Should we sing it now?
No, one back, one slide. Yeah, that's the one. So just to introduce, what is the network? It's an interagency network. It's an informal network. You have WinS practitioners, you have academia, but you also have the bigger development partners. And the network supports a lot what Christie has just presented, to support groups, to implement or to reach the SDGs for WASH in schools, what she has just presented, the access to basic WASH services in schools, and also supporting ministries of education to get there, and also supporting the monitoring. The network also holds regular meeting and is also supportive to conduct this ILE, this so-called International Learning Exchange, which happened since 8 years, since 2012 in Southeast Asia, where ministries of education and development partners come together for a week to learn from each other, to introduce new ideas, concepts, and to visit schools together and discuss what they've seen. And the network also has 5 different working groups. There's a working group on monitoring, a working group on creating evidence, that's a lot with universities, a working group on MHM, a working group on program guidance, and a working group on advocacy. Christie is leading the working group on monitoring, and I'm much involved in the work of the program guidance. But others are active in these other fields, and it would be great if there's more interest now joining these different working groups and also supporting the network and becoming active in joining events. Yeah, there's knowledge sharing also on discussion platforms of Yammer, the Yammer platform, and also the SuSanA platform. Just recently, related to COVID, the network came together, became very active to look to see, okay, schools now with the school closure and the situation of COVID-19, it's very, very important that there is information around and resources for the safe reopening of schools. And the network was active to gather valid and solid and reputable sources of information and came up with a list and a so-called knowledge map. So all of you are invited to use this knowledge map and look at it. I think the link has been done in the chat box. I did it at the beginning of the session, so the link is there, so you can get to this knowledge map. And that is, on one hand, it's for ministries of education, but it's also on even up to school level and families. You can look what kind of information is around and which could help to provide knowledge. Next slide. I will just show another product. Can you do the next slide, please?
I can see it here.
I don't see the next slide. Okay. Well, the next slide is exactly on the 10 immediate action points. I can see it now. Yes, so this is something that's also the link is also in the chat box. This is a list coming up for schools to really look at 10 immediate points, what they could do on school level and to focus, to help to focus. And this list has also been with the help of many network members and many people, perhaps some already also in the audience, have supported the translation. I think it has been translated to, I think, 12 or 13 languages already. And of course, people are invited, if you need it in your language, translate it, and we can also support that it comes out in that beautiful layout. So that's something, and we have received a lot of feedback, specifically also from UNESCO, saying that they find it very, very useful, and they have also widely distributed this 10 immediate action points. So it's, I think, a great resource for people in the room as well. The next slide, please. Yeah, the next one is sort of a checklist for schools, which is even going down to a bit more detail, that we really encourage the use of checklists. This is, you can use this checklist, or you might, in countries, you might need to adapt that to your local conditions, which is really helpful to manage the responses. This is a checklist to the responses to the COVID-19, specifically on personal and environmental hygiene, on hand washing, availability of water and soap, but also cleaning and surface disinfection, and come up with clear checklists in order to establish a routine. We know that routines need some sort of guidance, and the checklist will be very helpful for this. I think this is all at the moment from the next slide. There's one more. Yes, there's one more. A new publication coming out is then the guide on nudges to improve hand washing with soap in schools. This is a publication that's been developed by the London School of Hygiene and Tropical Medicine, and is supported by the Hygiene Hub. And it's a beautiful publication encouraging the school community how you use environmental nudges and what can be done to increase and improve hand hygiene habits and routines in school. And you can see, this. Thank you for your attention. I think what I wanted to show is that there are quite a lot of material now helping the specific situation at the moment with respect to COVID-19. I think this is one of the biggest crises ever the education sector has faced. And I think WASH in schools plays a very, very big role to overcome this crisis and to work on this. And therefore, I think this is all of us are much needed to support the education sector in this entire process of reopening of schools. So I can also imagine there might be questions, so I will stop here and happy to answer on questions. And I think also Christie, because she's doing the also the other working group lead. She's the working group lead for monitoring, so it's also great if she could join and is also could still be available for answering questions. Thank you.
Thank you very much, Bella. Christie, you are muted just in case you are speaking. I have a note in the chat that some participants were not able to see the conversation which is going on. So just and one participant had to leave the call and join in again. So just in case you cannot see, we do have a chat function that has the name of this meeting, so in which you can comment. I can see there has been a lively discussion regarding monitoring and data collection and rural and community owned data collection. I just would like to remind you, we have about 15 minutes till the end of the session, and I'll be now taking up questions. So if you would like, you can raise your hand and I'll be calling you. Otherwise, we can go through the questions that are in the chat. In case, Christie and Bella, you had spotted one that you'd like to address, please feel free. Otherwise, I would just need a bit more time to go through the comments that have been here.
Yeah, I think it's good if somebody has a question. Anjali, please put it up. It would be great if people, can you see the raising hands? Cecilia, can you see that?
Yes, of course.
Okay.
And I see that Ibrahim had raised his hand, so you are welcome to put up your question.
During COVID, we need more hands.
And if you may just say something, if you adjust your camera, then we'll probably be able to see you.
My camera is on. Can you see me?
We can see mainly your wall, and your front head. But yeah, just go ahead, please.
Okay. During COVID, we have to arrange more hand washing facilities for the school students. But it means we need more water, more soap, and to maintain these, we need more money. Very difficult to get this money from the government. How can we manage this money? Is there an example to mobilize the local resources to maintain the hand washing facilities in the schools in any country?
Yeah.
Thank you, Ibrahim.
Christie, perhaps I answer and you follow. Is that okay? I think you make a very valid point. It's a very, very important question. There is not enough water. There are not enough hand washing facilities. And this is really, really difficult. But I think there is a stepwise way to go about it. We all know the most simple hand washing facilities we could do are just tippy taps. So even schools can really just there's the very, very simple ways of doing it. There's also a catalog on hand washing facilities for schools, and you can use, and there's really an instruction how to use tippy taps. So even this is very simple, but it can be done. And then by and by, you can increase and see, perhaps you can get money from, as you say, the local government or the local community. Is a priority, and it has to have more priority from all ends. So I think it's important to make that, to bring that in and just start with what you have. I think that is so important. Start with what you have and do advocacy to get more solid infrastructure perhaps. But I'm always saying any simple tippy tap is doing the job. And I think let's at least see that can be done. But it's a very good question.
Excellent question. And maybe just to follow up, if you find the knowledge map, I think the link was put in the chat. There's a number of resources here that go through what Bella's talking about. So there's how to build your own tippy tap, a technical brief on contactless hand washing stations, And then, as Bella mentioned, a compendium of hand washing facilities for low resource settings. So all of that should be in the knowledge map.
Thank you very much, Bella. Thank you, Christie. Thank you, Ibrahim, for your question. I see another participant with the hands. Well, now I see two. I'd like to invite Anjali to pose your question. Feel free to turn on your video in case you'd like us to see you.
Good evening, everybody. I'm Anjali from Nepal, and this is a very interesting and very relevant topic that we are discussing here in this forum, and I'm happy to be participating in it. You know, in the context of COVID and reopening schools after this, I think it's not just about ensuring hygiene practices when the students are going back to school, but you know, in the context of Nepal, I don't know how it is in other countries, but most of the government school buildings and it is equally important to, you know, plan and see how these facilities are hygienized and made sure that the school building and the compound are safe enough to bring you it is possible to ensure that the facilities are safe enough for the students. So if I could get some insight on that about it. Thank you.
Anjali, thank you very much for your question. The connection was cutting a bit. Bella, Christie, were you able to get a hint what was about? And just perhaps another reminder to Raid Harvey, your video is still on. So in case it's not voluntarily put it on, then I kindly ask you to remove it.
Sorry.
Yeah, perhaps Anjali.
Could you not hear me? My connection is not very good.
Anjali, I think we got you more that you, I mean, I repeated, I understood that you see this not just the hand washing facility, it's the entire school and the cleaning and disinfection and all of these aspects. Are they really properly taken care of, right? Is that what you asked? That is what I understood. It was a bit chopping, but I think that is what I understood. Yeah, I think I can imagine that is a big challenge, and I think it's not something that will change overnight, but I feel that this current situation that schools are closed has such an impact on families, on communities, and everybody knows we can only open if we open safely, which means that personal hygiene and environmental hygiene standards are being met. Otherwise, they cannot open schools. So I expect that not only the school itself, but also the community and the families will have an interest that these aspects are being taken care of. And each country will have guidelines. Each country will have their own standards or standard operating procedures. I'm sure of that. But you could use the checklists and the guidance, the action points. A lot of points are being mentioned there. I think you can use this as a guide, which was in the chat. Yes.
Thank you, Bella. I see that Tapandas has a question and has already joined us in the video. Tapandas, if you are able to unmute yourself, and then after your question, I kindly ask you to mute yourself back. And then next coming here, we do have Rahul. And Anjali, in case you feel that your question has not been fully answered, please feel free to post it in the chat, and we might address that afterwards.
May I come in, please?
Yes, please.
Yeah, actually, we are talking much about the schools and all. I don't know whether the infrastructures and facilities and behaviors, those aspects of preschools are also included, because those are the very most vulnerable among the students and all. And many countries, especially I find in India, and there are a lot of gaps of facilities. I think whether, that should also be included and rather emphasized, because those are more vulnerable than the younger school students. I'm talking about the preschool students.
Yeah.
Thank you, Tapandas.
I think, Bella, do you want me to?
No, I think you answer. I think it's a good question. It's your question to you. This is important.
Excellent question. Yeah, that's such a critical age. On the monitoring side and trying to figure out what the situation is in preschools, it's been a bit challenging because in some countries, preschools, pre-primary fits under the Ministry of Education. In other cases, it's another ministry, or even the majority of preschools are non-registered. They're community schools. The government doesn't really have a system to find out what's going on or to even help manage things. So it's a really tricky gap area. And I think that's part of why when we can find data on pre-primary schools, we see coverage is actually even lower. So it's an excellent point, and something that, maybe we can all push national governments and community to focus on. I think you bring up a really, really good point. Bella, do you have anything to add?
Yeah, perhaps just that there also in the past, there is really the relation that you can say the older the kids are, the better are their wash in school situation in schools. So governments provide better situation, at least many governments, to secondary schools than to primary schools or pre-primary. So I think the importance for really putting wash in schools for the small children has been not high enough on the agenda, and I think it's important that you mentioned this. So I think all of us a wake-up point you bring up here, that we should look for, that is so important for small children. Yes, thank you so much for bringing that up.
Thank you very much, Tapandas. Thank you, Bella. Thank you, Christie. We had a question from Raul. Raul, if you can unmute yourself and raise your questions. I've seen that there are some comments on the chat. We can take perhaps another two here on the people who have raised their hands, and then have a look at the chat.
Am I audible?
Yes.
Yeah.
Thank you, Raul. Go ahead.
Hello everyone, I'm Rahul from India. Currently I'm working in UNICEF, and previously was in Tata Trust. So my question is, we are talking about infrastructure development and school knowledge management and in the curriculum and all. But what about the behavior change? Are we looking for that? Because whatever in vulnerable countries like India and other, so providing infrastructure is kind of different thing, and put that infrastructure in actual use is some kind of other. So if we're looking for the long-term results, so the school is the virgin place where we can produce knowledge, and we are preparing students for the future. So what about the behavior change? I just want to ask you guys your thoughts on this. How can we prepare for that student to wash their hands, to adopt the safe and hygienic practices in their day-to-day life, so they can transfer their practices to their family, and by this we can go for the community. So I request you to please comment on behavior change. Yeah, that's all.
Yeah, perhaps I briefly thank you for. Yes, thank you. I mean, Christie, I do it. It's okay. Thank you very much for your very important question. That really is, how do we support the development of habits? That is so important, and how to change behavior. That's the $1 million question, and I think that is the very, very crucial point. It's on one hand the availability of functional infrastructure, very clear in schools, but on the other hand, it's also developing sort of a culture of hygiene and cleanliness in school. which is so important, but that means you get into routines. I think schools are organized around routines. So therefore, I think getting routines, for example, now entering the school ground, you wash your hands, and prior to eating, you wash your hands. That is something you can do, you can manage that. That's really done as a clear rule in the school. Everybody has to do that. You get into that routine. And also to wash your hands after using the toilets. And many schools now around the globe even have more points where they want children to wash their hands when they change rooms, before they leave, when they leave school again. So of course that increases also the demand for water and soap. And very important to come up with estimations how much money would the government need to put in for that, or who else would finance the gap if this is not coming from the government. But there is clear, if you ask for the routines and for the development of habits, you need routines. And I think the publication on the nudges, which comes from the Hygiene Hub, is also a very good support on developing habits and encourage behavior change. Thank you for that excellent question.
Thank you, Bella. Then I have already the last hand on here. So Kasawe, if you can unmute yourself and pose your question, please.
Thank you so much. For me, it's not really a question, but it's just to share a little experience. So I'm coming from Zambia, and specifically Lusaka, where we are also promoting and championing Wash in School through a program called Green School Partnership Program. So what we have done is that we are targeting much of our work at district level so that, we could influence actually the national policy in terms of getting a more structured and a very well-organized Wash in School program as far as monitoring is concerned, investment in infrastructure and other specific tools. So for me, it is just, I think, a commendation, I think, to the SuSanA platform, because we have quite utilized a lot of information from that platform, I think, through this program. And of course, the interaction with Philippines, because Zambia was part of the countries that had an exchange experience with Philippines, and we learned quite a lot on how they started, growing a basic Wash in School program, and how it has grown and how it has moved from just, addressing the basic service criteria, but also moving to the advanced criteria. So for me, I think through that experience, it was very easy for us as a Green School Partnership Program to start a COVID response program called Safely Back to School campaign, to just ensure that even as schools are opening, amidst of the low-level kind of infrastructure that are already existing in the district, we can try to provide the guidance and the support to ensure that the gains that are going to be made during this activated time period in time of COVID, in terms of a lot of interest, people investing in infrastructure, but ensuring that we are creating we are institutionalizing, but also we are creating a very sustainable system to ensure that the gains that we are going to have through this COVID, are not lost in the future. So that was just my input.
Yeah, thank you a lot.
Thank you also very much from the SuSanA Secretariat side. We are always pleased to hear that the network is being used and the knowledge who is shared here is being taken up and applied in the project, and also bring it back to the network and exchanging in such a nice format that we have today. So we are getting close to the end of the session that we had planned for today, right? I see that we still have a number of questions in the chat that I invite you all to continue the conversations on the SuSanA forum afterwards. And also, of course, Bella, Christie, in case you would like to say a couple of words before we close the session, you are welcome. The floor is yours.
Christie, you first, or?
Sure, just a quick thank you to everyone for the great questions and sharing your experiences. It's interesting times for sure, as Bella mentioned, but we have a great group of people all focused on trying to make things better in schools. So it gives me a lot of hope.
Yeah, thank you. There's not much to add. Thank you also so much for your interest. I think there's a lot of energy at the moment, as Christie said, and a lot of people really want to do, and we all need to do. Otherwise, we cannot open the schools again. And that is of utmost importance to open the schools again. That is so important. And I think just to add that, the network is currently working to develop a web page, so a website, so that you can easily access also information just related to WASH in schools and important other information. So it will be more at a resource website, but we will also see that we will have something there where you can leave your messages, you'll be on a mailing list. So we're very, very interested to reach out, and we plan a bigger meeting at the end of the year where we would like all organizations interested in the topic of WASH in schools to come together. We will put efforts in strategizing that, and we will reach out again Please look at the SuSanA website. You will find information on that upcoming event. It will be at the end of the year, but we all need to join forces to improve the situation for WASH in schools. And thank you a lot, Christie, for working so hard on the JMP. That is so important. Thank you all.
All right. So from my side, also a big thank you for Christie and Bella for being here and sharing with us some insights on the topics. Also, thank you to everyone who has been who has joined the session, contributed to the discussions. You are really welcome to have a look at the program of the 30th SuSanA meeting and register for the sessions that you have interest. We will continue. In about 1 hour, we will have a session on reopening public toilets. In case you are interested, please just join us. We'll be happy to have you around. Thank you very much for your lively participation and discussion. Hope to see you soon in any other sessions of the SuSanA.
Yes. And thank you a lot for moderating the session. I forgot to say that. Thank you so much, Cecilia. You did a great job. Thank
My
you so
pleasure.
much.
Bye.
Bye-bye. Thanks.
Thank you.
Thank you. Bye.
Bye.